The next speaker is Dr. Santosh MAHAPATRA.
Good afternoon. I'd like to thank AIOS and OSS for the opportunity. Here I am here to discuss light at the end of the tunnel. Is it possible? So as you all know, RP is a non-treatable disease for all of us, and it is associated with more than 3,000 mutations, and more than 1.5 million patients are there, but it don't have a specific therapy. So most of the patients, it is so much degenerated that the rods and cones are not there. So we thought of a therapy which can target all the genetic mutations, as well as a patient who is in advanced stage and not having rods and cones. That's why the multi-characteristic opsin, which is a bioengineered ambient light sensitive fusion protein, came to the minds of Nanoscope Therapeutics, who had contacted me 10 years back in 2015, but it was not believable at that time that gene therapy is possible for the RP patients. And that's why I personally wanted to visit US to see actually they're doing something or not. This is, they said, it simply can be injected intravitreally, and the target cell is bipolar cells. So this is where I was in 2017 to visit their lab and actually see whether it is actually ongoing work or not. And this is the mice model they have shown me, pre-injection and post-injection, where the mice can actually reach the target. And with this, after ethical approval, we started the journey in 2019 with selection of 11 patients who have been injected with multi-characteristic opsin and divided into 3 groups: the low dose group of 3 and higher dose group of 3 plus 5, that is 8 patients. And they are followed till 52 weeks. We injected only those patients who have just light perception or hand movement in the injected eye, and not better than counting finger in the fellow eye. And this is the neutralizing antibody test which is showing all the patients. We ensured that no detectable neutralizing antibody is present in the serum of all these patients, because otherwise the injection will be destroyed by the neutralizing antibody. And the safety was the first concern. The MCO was well tolerated with a good safety profile, and there is no detectable retinal toxicity which was shown on multiple serial OCTs. And there was a good improvement in fiber visual acuity, which had more than 30 letters improvement at end of the study, and which is also documentable by fundus autofluorescence showing the M-cherry expression. This is one of the patients who has undergone Y mobility test, and you can see the behavior of the patient pre-injection, where the patient is trying to find the light which is placed at the level of the eye. 2 panels are there, one is lighted and other is dark, and this is following injection at 16 weeks. Patient is directly approaching light following injection and able to locate it. So to summarize, that 52-week study gave us a good safety profile with minimal adverse effects and a very good score in NEI-FBQ score. And with this, they went ahead for a restore study at US at 6 centers, where they have extended study till 72 weeks. At 52 weeks, they had a good response, and that's why they have extended it to 76 weeks, which also showed a good response with a good safety profile. And to the summary of the study, they have told that the over 2-year period, the improved visual acuity was sustainable, but the US FDA needed a long-term follow-up, at least 4 to 5 year follow-up, to prove the safety before recommending the drug for market availability. And with this, we also published the paper in molecular therapy, and we have done the long-term follow-up study in our center, where all the patients who have been injected with MCO were called upon, and all the safety features were re-evaluated at 42 weeks, and we will be completing the study of 60 weeks in next 2 months. So this shows that the improved visual acuity which was achieved following injection is still sustainable without any long-term intraocular inflammation at 4 weeks, and there is a very good safety profile without any retinitis, choroiditis, vasculitis, ischemic neuropathy, hypopyon or on the treated objects, and there is no decline in visual acuity due to NCO treatment in contrast to the natural history of the disease. So to summarize, the results indicates that VMCO is well tolerated with no reported serious adverse effect. There is no anterior chamber cells or vitreous cells or flare, and no subject required medication to treat ocular adverse event at the 4 years. The benefit of the treatment was observed through improvement in pre-treatment baseline quality of life assessment of activities of daily living using National Eye Institute BFQ25 score. And with this result, they have applied for a drug license in biologic to US FDA in the first quarter of 25, and they're expecting a approval by end of 2025, and the drug may be available in early 2026, where the RP patients may see the light at the end of the tunnel. And this is subject number 003, who was carried by her son to my clinic and is now able to read the room numbers which has pasted in just at the entrance of our clinic. So thank you very much. And
Thank you, Dr. Santosh. One
questions?
Can we give this medicine at the first diagnosis?
Yes, but now we have just included patients who have advanced stage of the disease with just perception of light and hand movement, because we are still assessing the efficacy of the drug as well as long-term safety profile. Once the safety profile and long-term efficacy is established, we can include patients who have better vision, and they can also be taken up for the first instance.